Hi, I'm Carolyn McClanahan. This is the second of my video series on healthcare reform. In the first video, we covered the history of healthcare reform, which is very interesting. But now we're going to move on to the cost of our healthcare system, which is even more fascinating. So let's start. First, let's go through healthcare as a percent of our gross domestic product. So that's how much money we spend in our entire system, how much of it goes to healthcare. In the 1970s, 6.2% of our GDP went towards healthcare. Now, it's well over 17%. This compares to other OECD countries. OECD countries are basically large industrialized nations, places where you'd probably be very happy living. So in the 1970s, they spent 4.6% of their gross domestic product on health care, and now the average for other OECD countries is 9%. So we spend a heck of a lot more than other countries on our healthcare system. And as I'll show you in a little bit, that does not translate into better care or better health for our country. So what do we spend per person per year? In the 1970s, we spent about $327 per person per year. That compared to other OECD countries, average of $180 per person per year. And that number has escalated through the years. Now we spend well over $10,000 per person per year on healthcare in this country. Other OECD countries, 2015 is the last year we have all the data for, they spend about $3,800 per person per year. So we spend way, way more than other countries. Now, the average annual rate of inflation for healthcare in the U.S. has been 7.76%. All other countries, when you take the U.S. out, has been about 6.92% average. This is since the 1970s. Now, you'll see these other countries have high healthcare inflation too, and that's because we have so much we can do in healthcare now with all the technology and all the treatments. Other countries are facing pricing pressures too. However, they started from a much lower base, so their costs haven't escalated as much as ours have. What about healthcare expenditures by the government? So in our system, the government pays part of the cost of our healthcare needs, and that of course is passed through to taxpayers, and then the rest of it comes out of our pockets directly. So in 1970, the government paid about 37% of healthcare costs. That compared to other OECD countries of about 68%. So in other countries, the government picks up a bigger part of the bill for their healthcare needs. Now you can see the amount that the government has paid going forward has steadily gone up. And right now, the government pays about 50% of our healthcare costs in this country. The other OECD countries, it's gone up a little bit, not as much. Now, what's fascinating to me is when those costs escalated. So you'll see from 1970 to 1980, that's when Medicare bloomed unchecked. And so the government went from paying 37% to 42% of healthcare costs. When President Reagan came in at the beginning of the 80s, he said, I want to cut how much we're spending. He actually made a lot of Medicare cuts, and you'll see from 1980 to 1990, the amount the government put into healthcare went down. But at the end of Reagan's tenure, he did the biggest expansion of Medicare since it was enacted. And so that, again, went unchecked from 1990 to 2000, and the government was paying 44% of healthcare costs. From 2000 to 2010, remember at the beginning of Bush's tenure, the second Bush, he enacted Medicare D, so the second greatest expansion of Medicare, and we went from 44% to 48% of healthcare costs, so of government paying healthcare costs. The ACA by the end of 2015 hadn't really taken much effect, but by now the government's paying a little bit over 50% of healthcare costs. Now, where does the government spend money on healthcare? You know, the biggest expenditure actually is Medicare, and then we have the spending for Medicaid, and so there are a lot of different areas where we actually spend directly, but one big expenditure you'll see is the expenditure for employer deduction from health insurance. So employers get a deduction from their taxes when they pay for your health insurance, and that translates into $150 billion a year. So that's a huge chunk of money we pay towards health care indirectly through the government. Now, with all that spending, are we healthier? And that's absolutely not. We have one of the lower life expectancies compared to other industrialized nations. We have the highest rate of obesity. We have double the infant mortality of other industrialized nations. It shouldn't be that way. And so, I just circled on here, look at Japan's obesity rate, 3.7%. Goodness, we need to do something differently. We need to tackle our health care issues by fixing some of these medical problems, and the amount of money we're spending isn't doing it. We need to fix the system. So look at ischemic heart disease. You would think that in our country where we get great care for acute illnesses, accidents, or rare illnesses, that we'd also do a great job with ischemic heart disease, but we don't. So despite all our spending, we are actually worse off than many other countries on how well we treat heart disease. So we're not great at the things where it really counts, and that's preventive health and common problems like diabetes, heart disease, obesity, lung disease. That where we are great is when you get rare disease or accidents or cancer. People talk about, well, other people from other countries come to the United States for their care. Well, that's because we're great at those rare things that happen to people, but nobody comes to the United States to take care of their diabetes or hypertension. So what do other countries who spend less money and are healthier than us do? They have incredible primary care systems. That's so important because good primary care helps us keep our health. And one other thing they do is choose one healthcare system. We have 4 types of healthcare systems in this country. We have government paid, government provided. That would be the VA and the armed services. We have government paid and privately provided. That would be Medicare and most of Medicaid. We have privately paid and privately provided, which is regular insurance like we get through our employers or we buy on our own. And then finally, we have the millions of uninsured who have to negotiate for them by themselves on how to pay for health care and how to get through the healthcare system. So that's the cost of our healthcare system. In the next video, I'm going to cover the rise and the fall of the Affordable Care Act. Thank you so much for listening.